Thank you, Speaker. My question is to the Minister of Health and Long-Term Care. My office continues to be contacted by constituents who are still uncertain of the safety of drugs administered in the hospital, and it is no surprise why. Friday, we learned that 26 more patients were affected by the misdosing of chemotherapy drugs. And everyone is still confused about exactly who is responsible for ensuring the safety of all drugs brought into our hospitals. No clear answers are coming from the hospital, the drug companies, the regulators, or the ministry. Why has the minister allowed the confusion to continue for so long?
Well, thank you, Speaker. And I think it's important to acknowledge that this is a tremendously difficult time for those cancer patients, Speaker. They have all been contacted, Speaker, and they are meeting with their oncologists. Speaker, Neil Johnson, the Vice President of Cancer Care at London Health Science Centres, has said that his medical oncologists have reviewed the cases. They are confident that there is no causal link between the underdosing and the deaths. He said, I'm saying it didn't contribute to the deaths, Speaker. But what I can tell you is that we must get answers to questions. I wish there were simple answers. I wish someone would stand up and give us all the answers. The reality is there are many layers of accountability, Speaker. We must ensure that all of those partners who have a part of the responsibility are together. That's why we brought them all together, including Health Canada, who has a very important role to play in this, Speaker, to get answers to those questions.
Speaker, the London residents are gravely concerned that the Minister of Health, who is also the local MPP to so many, has been so missing in action. She has been unable or unwilling to answer the most basic questions of oversight and seems to be more concerned with dodging responsibility than answering the questions of her constituents. For London residents like Barry, who was given the wrong dose and who will find out this month if he is cancer-free in the next 2 months, this confusion is unbearable, Minister. Speaker, will the minister please do her job as both the MPP for her riding and the Minister of Health and allow Ontario Ombudsman to do his job and get to the bottom of this?